Thank you. I always wanted to do that. Good evening and welcome to the Prescott Town Council meeting for December 2nd. Mayor Shankar is away tonight, and I want to welcome a couple of people in the audience. We have the mayor from Brockville, Matt Wren, welcome. And we have Craig Warden, welcome. And Deputy Clerk is online, Caitlin Mallory. So welcome, everybody. So we'll start with number 2, the approval of the agenda, that the agenda of the council meeting December 2nd, 2024 be approved as presented. Can I get a mover for that? Thank you, Councillor Young. And second it by Councillor Lockett. Any discussion on the agenda? Seeing none, all in favor? Thank you, it's carried. So we have no declaration of interest or presentations or delegations. Moving right along to number 6, the minutes of the previous council meeting. The motion is that the council meeting dated November 18th, 2024 be accepted as presented. I'm going to need a mover for that, please. Councillor Kirkby, thank you. Seconded by Councillor McConnell. Any discussion on those minutes from November 18th? Seeing none, all in favor? It's carried, thank you. We have no communication or petitions. Number 8, there's a council information package. The motion reads that all items listed under the consent report section of the agenda be accepted as presented. I need a mover for that, please. Councillor Campbell, thank you. And seconded by Mr. Kirkby, thank you. Anything we want to discuss or pull out of the consent reports? For me.
If I may just discuss one thing.
Councillor Kirkby, yep.
Yeah, so everybody here is aware, but maybe not online or in the audience. There is a tri-municipal challenge, food drive challenge going on against, so it's Prescott, Augusta, Edwardsburg, Cardinal, for who collects the most food or donated cash for the food bank. So last year Augusta won it on a technicality, I think.
Yeah.
So obviously we want to win, but the big goal is that we support the food bank. So we'll have food collection at the Elaine Chartrand Center. It's there now, and it'll be there, I think, till the 20th, maybe. Maybe I'm wrong on that, but don't quote me. Get your food there right away. And then we'll have a collection down at the Riverwalk Wonderland pop-ups, December 6th and 7th. So another collection point there, which hopefully can bring us home the trophy. There's a trophy. There was a trophy last year. We'd like to see Prescott on it this year. Thank you.
Absolutely. Thank you. I did want to mention too that the TIS basketball girls team made history. Over the last 20 years, they've never been able to go to OFSA in North Bay. So they made it to OFSA and they gave it their best. And competition was pretty steep. And I think it was in the last 90 seconds that they lost. But they played hard and had a great time and good community gathering and support for the girls basketball team. So, is there anything else from the information package? No? Okay, I'll call the question. All in favor? Thank you, it's carried. So there's community reports, there's none. Mayor Shankar is away. So we're moving on to outside boards and committees. And we'll start with Councillor Lockett, please.
Thank you, Deputy Mayor.
Thank you.
So I attended a meeting of St. Lawrence Lodge this week. And it's a work in progress. They're working on a budget and they came and presented what they had so far and we haven't been able to get monthly reports, but that's going to start now and we'll be getting a monthly report. They also had an outbreak in October, but it's all under control now, staff and residents have been, had their vaccines for flu. Also attended, the Board of Health meeting. They're, still working ahead, forging ahead with their merger, and they're hoping to have, some news this coming week. I attended Steve Clark's, skating party yesterday, which I did not skate, but I did visit, and, I saw Mayor Wren there. He didn't skate either. I just want to say that. And, he was the first time in our building, and he had a little bit of a tour. Also, I think that, we all got information that, Mayor Corina Smith is now the new warden for Leeds County, so congratulate her. I think that's it for me.
Great. Thank you. Councillor McConnell?
Thank you, Deputy Mayor Burton. It's too cold to work in the cemetery, so I've got nothing to report there. We do have our meeting upcoming shortly, where we will be determining the price structure for the coming year. I think there is something in the budget that I read in regards to the cemetery board, an increase in how we want to allot to them, which is needed, quite frankly. Other than that, the meeting that we all attended, say Tracy, with Augusta Township and Edwardsburg Township, was very informative. And I enjoyed that because everybody got to speak, everybody got to say what they thought. And it was interesting to hear the other opinions on the situation that I was very thankful that Augusta actually brought forward. Thank you.
Thank you. Councillor again?
Thank you, Deputy Mayor Burton. So updates from the ECDAV department. The Prescott Holiday Shop Local campaign is now live, and it's running on social media under Explore Prescott. It's on Moose FM, and it's in the South Grenville Beacon. So it's just promoting shopping locally for the holiday season. A reminder about Riverwalk Wonderland. It's this Friday from 5 to 8. The tree lighting is at 6:30. And there'll be reindeer, Santa photo booth, 3D glasses again that were really popular during the parade. They'll be given out, and wagon rides. And then again Saturday from 12 to 4 down at the Prescott Pop-Ups. And the downtown bingo launches December the 6th. So it's actually a bingo card, and it's activity based. So for example, one of the squares would be a selfie in front of your favorite decorated store, or finding the perfect handmade gift. And then when you fill your whole card, it goes into the grand draw for $250. And then there's smaller prizes too, if you get all 4 corners or diagonal lines. So that should be lots of fun. And it's starting on the 6th as well. And that's every, oh, the branding and remarketing it's down to 8 finalists for consideration. So they'll be interviewed this week. And that's everything for me.
Thank you. Councillor Campbell?
I was to attend the fire administration meeting tomorrow night, but they have postponed it till the new year, so that won't be happening. And as Councillor McConnell said, we all attended, see Tracy, the Tri-County meeting last week, and I also found it very enlightening, the discussion that we had. So that's it.
Thank you. Councillor Kirkby?
Thank you. Through you, Deputy Mayor Burton. Just some updates from around the town as far as operational. The water tower, the new water tower has come online as of last Friday. The old one is now isolated from the main system. The ditches on Fort Town Drive were redone. They hadn't been redone in years, and they're full of stuff and just not functioning properly. And the culverts in the first 3 driveways were replaced. Outside of that, just something to note, that we're hosting a big hockey tournament. Everybody knows I'm involved with South Grenville Minor Hockey. So there'll be 24 U9 teams come through Prescott on Saturday. They're in the area Saturday and Sunday. Unfortunately, they're in Cardinal on Sunday, but in Prescott. So Should be a lot of extra traffic in town and hopefully they filter down to our Wonderland. Outside of that, that's it. Thank you.
Great, thank you. I have a few things on my list tonight. We had 55 families attend photos with Santa and the cookie decorations at the ACCC. That was great. I even had to have a conversation with Santa and tell him how good I was all year so far. So he said, I'm on the good list so far, so. Next week, we have registration for the 2025 holiday activity kits that can be picked up through our town and I believe through our library. And our facilities around town are really being utilized. We went up from 393 last year, and this year we're already up in November at 515 rentals. That's pretty nice to see. And the tree lighting, as Councillor Young mentioned as well. So that's it for me. So we'll just move right along.
Excuse me, can I ask a
Yes.
question?
Absolutely.
Regarding to something that Councillor Kirk mentioned, the new water tower coming online. I dropped some leaves back at our facility on Saturday and I couldn't help but notice that the pipe that's coming out of the side of the base. Is that just kind of an emergency thing, if something went wrong or what?
So it's a temporary dam. There needs to be a concrete pad poured right below it. And then it will be removed and they will install what they call a duct bill, which will come out for the overflow in the tower. So if we ever have an overflow situation where we need to purposely overflow the tower, it comes down there and out and shoots out into the ditch and whatnot. So that's why there's kind of the water drop that you see there and it goes into the ditch. But we're just waiting on that concrete pad to be laid, and then that way, because the duct bill will the water will come down onto that concrete pad and then extend from there.
Thank you. I didn't think it looked like it was part of it.
No, I had the exact same question when we were doing marketing. I'm like, that's not staying in there. And no, it's absolutely meant to be a little bit prettier than that.
I caught them there one day on a Friday and we'll chat with them. Got the answer.
Nice. Thank you, Matthew. Oh, Councillor Campbell.
For you to Ms. Belkamp, the holiday activity kits, are we still going to be delivering them or now are people just coming to pick them up?
So through you, Deputy Mayor, you could reach out to Samantha. I'm not quite sure if she's taking you to do the delivery or not.
We actually are going to be
Yeah, it says
delivering
that.
this year again. Yeah, I'm sure she'll be reaching out and letting council know. All right. Okay, we'll move on. We have 4 staff reports here tonight. And our first report is 2025 budget assumption presentation. And our CO Matthew Armstrong will do the presentation. Thank you.
Very much. This is a similar presentation to what we were going to talk about at last meeting. Unfortunately, I wasn't able to attend. We do that, so we're going to go through this evening. So we're just going to go through timelines, our revenue assumptions and information, our expense assumption information, and then we're going to talk about a possible range for property tax levy. So next week, we'll start with health and social services. Then after Christmas and the new year, moving on to administration and protective services, as well as going through the initial project list. Later in January, transportation, parks and recreation. And then February, finishing out the expenses side, as well as later in February, looking at the revenue and project prioritization, so that we can then take an overall look in early March to determine how it aligns and see where we go from there. So the first revenue assumption that we have is that OMPF, which is the Ontario Municipal Property or Partnership Fund, is increasing. It's the first time the overall envelope has increased in quite a while. It was part of the fall economic update from the province of Ontario. And so the fund will be moving to 550 million in 2025 and be moving to 600 million in 2026. So that means for the town of Prescott that we receive an increase of 140,000 in 2020. An increase in 2025 from where we were in 2024. So as I mentioned, this is kind of the first time in quite a while that overall has increased. And I think it's a reflection of the government seeing exactly the pressures on municipalities that we're facing. From a community infrastructure fund, so overseas funding, we use that money. Previously have used it for repaving projects as well as a bridge rehabilitation that we finished last year. And so you can see from 2021, they increased the overall envelope in 2022, increasing it from 200 to 400 million. And then there's been slight adjustments year over year. And in 2025, our allocation is going down 23,000, which means our repaving budget will go down by 23,000. That being said, 472,000 for repaving is a fairly healthy amount for us to be able to look going forward. And something that we'll be looking at for 2025 is actually redoing the street scan that we did 2 previous times. And I believe the last time was in 2022, so that we can get an understanding of how things are progressing in terms of the condition of our pavement, and that will help drive council's decisions around where to do those repaving projects. Some other revenues, so interest on our high interest savings account is decreasing as the bank account of prime rate is decreasing. Outstanding property taxes receivable are starting to rise slightly. However, we are seeing some good movement on people catching up on taxes. And then the provincial offenses, which is administered by the United Kingdom Scheme and Rebel, hasn't recovered to the pre-COVID period. So we've seen a significant decrease in that share over the last couple of years, and we're not expecting it to increase substantially in 2025 either. When we take a look at property taxes, so we're still waiting for the province to make a decision on when to implement the next revaluation. It was supposed to occur in 2021. It's been postponed. And even in the fall economic update, they gave an indication that it would not change in 2025 either. So just for an equivalency, 1% increase in property taxes equates to approximately $65,000 in additional revenue. From a salaries and benefits perspective, QP and non-salary increases aren't yet known. The QP agreement expires on December 31st, and non-union increases are tied to that settlement. We have non-union that will be going through over the next several months, and we don't know the effects of that at this time. We're happy to say employee benefits, the renewal came in at less than 1% increase, so it equates to about $2,700. And then as they're continuing to revamp the Canada Pension Plan, the maximum contributions again are increasing fairly substantially. And then that second additional amount for above the yearly limit to, I believe, somewhere in the mid 70,000s is going to increase 100%. So in 2024, it was $188. And if you're making above the normal limit and towards that secondary limit, it's now going to be $396. So not huge numbers, but it's still something that we need to account for when we're moving forward. From a liability insurance perspective, so it increased 16.26%, mostly due to the revised property insurance values. So we're assuming an increase of overall 5% in 2025. So the budget would increase about $47,000 between 2024 and 2025. Joint services, we're assuming an increase of 10% at this time. That's just shy of $65,000, and it's broken down by program below. Then public health, we're assuming a 10% increase there as well. And one thing that we have found in the last couple of years is that we were using 5% increases, and that certainly was catching us off guard when we got to January, February, and March. And so this year we've increased it to 10 to try and give us a little bit of wiggle room if they come in lower. Cemetery operations, and Councilor McCall mentioned this earlier, is that at some of the previous meetings we have been talking about at the cemetery board, just really focusing on some of the rehabilitation of stones and things like that. Also the cost of just the upkeep on a regular basis for the lawn and what have you is increasing substantially year over year, and there's very few providers that provide that service. One of the things that we also have noticed over the last couple of years is an increase in the community grant requests. And so what I was suggesting, based on kind of some of the feedback that I've been hearing, is tying it to 1% of our previous year's property tax. And so we increase, let's say 2% next year, then our allocation for 2026 would be 2% higher than 2025. So that way it's starting to increase. The 58,000 has been at 58,000 for the better part of a decade. Which is where we limited it, and so, but we are seeing a lot more requests coming in. So, thought it's certainly something that that we had in our initial assumption, but to be pulled out at a later date. Council wishes. Recycling pickup. So recycling is being taken over by a provincial consortium that is being supported and financed by producers of recycling materials. So. Previously, the town received a 50% grant of the expenses when it comes to recycling. So our grant was approximately $50,900. However, it cost us over $100,000 to actually perform that service. So with the it being implemented at January 1st, 2025, the grant will go away, but so too does the expense. So it's an actual net decrease in expenses of approximately $55,000. We will be talking about it at our next meeting. We have received confirmation that recycling days will be switching to Friday, as well as who the new provider is. And so we'll provide that at the next meeting, as well as there will be information going out to residents to cover that information as well. And then the Ontario Provincial Police increase, we've talked about that previously. Is $223,000 for 2024, or about 18.67%. That includes a year-end adjustment from 2023 of $74,000, which I mentioned at that time that we can book back to 2023, and this will result in an increase of $148,000. On Friday, the government did announce that they're proposing a $77 million offset for OPPA cost increases for 2025. We don't yet know exactly what that is, the effect will be. However, our understanding is that it will drastically decrease the $148,000 substantially. So while it's in our presentation this evening, as soon as we have that information, I'll be able to provide that and we'll have a better understanding of what that looks like. So when we take a look at St. Lawrence Lodge expenses, again, we're assuming the levy will go up substantially. In last year's, in the 2024 budget, you'll remember that we passed the budget with assuming that they weren't going to receive any more money and that there was going to be an 80% increase. When they actually did get their allocation for 2024, that decreased to a 35 or 36% increase, but we still have that money on the side in the budget to be able to cover future increases. So even if there's a 35% going into 2025, we would simply decrease the amount that we're putting in reserve. Therefore, there's no effect to the bottom line, because in essence, that was incorporated into the 2024 property tax increase. So one of the things that we'll also be experiencing is at the end of 2024, there's 2 loans and debentures in relation to St. Lawrence Lodge, the rebuilding that occurred back in 2024 and 2025, and they will be coming due no more payments at the end of 2024 for a portion of them, and no more payments at the end of 2025. What we will do is, instead of taking that and reallocating elsewhere, we should be putting it aside into a reserve for the next rebuilding, because believe it or not, that building is now 20 years old, and so it doesn't take very long to have to start looking at replacing when you're probably another 40 years out. So that's something that we'll do. We won't take the savings, but we will start putting that into reserves so that we can make sure that we don't have to increase property taxes substantially as we get down the road.
Oh.
So
Councilor McConnell, you have a question?
Thank you, Deputy Mayor Burton. The St. Lawrence Lodge money that we're putting away, as you mentioned, that there's two debts or the two debts that are being retired, one this year, one next year. When we're putting that money away, we're putting it away here, not in their books, correct?
That would
Because,
absolutely be my recommendation.
all right, because having sat on that board for 8 years, I know if either one of the two unions, not that I have anything against unions, but I've been a member of two. They get the idea that there is money sitting there. It makes the negotiations more difficult.
So it's a responsibility of the partners, the county of East Hamilton, City of Town of Prescott and Town of Gananoque to fund that. And so my recommendation would be that it would stay within our books and within our control until it's required later in the future.
Excellent, thank you.
Thank you.
I had some questions on different things, but I thought I could wait. So do you want me to wait till the end and then go ahead?
If you want, we can go through.
Yeah, let's do that.
There's a new slide and then.
Yeah.
We can go through there. So this is a new slide, because one of the things that I realized is that perhaps I wasn't showing kind of what the bottom line looked like. So again, OMPF grant, 140,000 increase, but then the blue box and the OSIF funding will go down. So net, at this point, we're seeing a $65,000 increase in revenue. From an expense standpoint, we know that the 105,000 is going to be decreasing in recycling expenses on January 1st. Our repaving budget will be decreasing. And then each of the items that we kind of go through that we just talked about, that's the effect of overall. So we're looking at about $154,000 in expense increases. That's not including salaries and benefits or salaries and wages. And which equates to overall, when you take the loan revenue and the increase in expenses, we're up about 88,700, which equates to about 1.37% for property tax increase. So I'll just stop there and maybe it's a good point to ask some questions.
Through you, Deputy Mayor. No, it's under through there.
Right?
Thank you. So Matthew, I was just on the benefits. So overall, for all employees, the benefits is rising by $2,000, not per.
No,
Right, and that's answered there. Just the Canadian Pension Plan 2, we called that out as an expense to our employees, correct? Is that why that's being shown? Because we don't pay that.
So there's an employer portion and the employee portion. So it's, in particular, the employer portion is going up, but so is the employee portion.
Okay, thank you, just for clarification on that. And then I guess we're increasing the amount of money, and it sounds like it's needed to the cemetery. And I heard Councillor McConnell say that you're talking rates. So just wondering, is there any information on when the last time the rates have been increased there?
If I may.
Yes.
The rates are looked at every year.
Yeah.
And if memory serves me correctly, not everything, and Matthew, feel free to correct me here, not everything has increased every year, it depends on what's going on, but traditionally we have been increasing the rates as we go on. So it costs more to get buried today than it does tomorrow. So if you're thinking, well, of course, you'd be in the Catholic cemetery anyway, wouldn't it? I was gonna say, if you wanted to jump on something. A lot of people pre-purchase a plot.
Yeah.
A plot is gonna be cheaper today than it's gonna be in 10 years, and it's more expensive today than it was 10 years ago. So yeah, we have been increasing, but we've been trying to keep up with
the cost.
the costs,
Yeah.
exactly.
Okay, thank you. And then just on the community grant, I believe currently last year we had money left over.
Which one from before, we have about 2,700.
Right, and I thought one time we said that we wouldn't roll that money over to the next year. I'm just wondering if maybe that's an alternative to the percent increase, if there's money unspent from one year to the other, is to roll it over to the next year.
Absolutely. So this will be the first year that we have an opportunity to roll it over.
Yeah.
Because we've spent it every single year previously. So absolutely, if council wishes to roll that over, then that would certainly be something that we'll do, and then create a little bit of reserve fund that will take in those increases, and then if there's a one-time that you want to support, it would come out of that amount.
Thank you.
Anything else? Yeah. Anybody else around the? No? Thank you.
So just the last slide, I believe, is kind of taking a look and based on what we know so far, is there a range that council would like us to work towards when creating the budget? So looking at, 2020 was obviously the beginning of COVID. We took that opportunity to increase the 0% in each of the following years as inflation has been increasing. Certainly, that's had an effect on property taxes. And then, as you recall, over the last, I think, 6 or 7 years, we've been adding on 1% for infrastructure. And so that's been allowed us to take on several projects that we wouldn't have normally had any funding source for, including the docks and things like that. So really, the question is there a range, or is there an upper limit that council would like us to keep below?
You around the table? Councilor McConnell?
I think that's, in all honesty, kind of premature, given the fact that we have to, well, whatever negotiations are with the union and of course staff, traditionally has been given whatever the same raises to the union. And given the difficulty, shall we say, of those negotiations this year, I don't see how we can possibly give you what we'd like. What we'd like, yeah, I'd like 2%, but that is not even possible. We need to have a little direction, I think, from yourself, since you're leading the negotiations with staff, to see where that is going to be, even roughly coming in before we can make any kind of a stab at it. I know that doesn't give you any indication from my point anyway, but you're already at 1 point, or whatever it was there here, so that's probably going to be a minimum from that amount, and then we aren't anywhere near the end of your presentations this year. So I think until we get some handle on the union negotiations, that would be premature in my opinion anyway.
Okay. Anyone else around the table? Councilor Kirkby?
Just to echo Councilor McConnell's thoughts there, I mean, I'd like to see it as low as possible, but we are in a negotiation part. Ideally, the same or less than last year would be always my goal, but I guess I agree. I guess kind of have to wait just to see what the negotiations bring us, which I think we talk later too. So.
Mm-hmm. Absolutely. Something that we can digest right now and think about it while we continue on our discussions. Okay.
No problem. I appreciate it. Thank you.
Okay. We're all good, Matthew?
Yes, I believe that's
Okay. Thank you very much. So moving right along to 12.2, we have staff report 93, 2024. It's a 2025 key infrastructure project approval. And the motion reads that that council directs staff to proceed with the following projects for 2025. 1, replacement of B, C, and D docks. Number 2, E Street reconstruction from Dibble Street to King Street. Can I get a mover, please? Councillor Young and Councillor Lockett. For discussion purposes, I believe our Director of Operations, Lockett, reports.
Thank you, Deputy Mayor Burton. So yes, this report is a sort of a continuation of the last meeting's introduction to the key infrastructure items. Specifically, there's 2 that we're seeking recommendation for proceeding with. So the first one is the replacement of the B, C, and D docks in the marina. So Kehoe Marina has completed an evaluation of all 3 of the remaining docks. The rest have been replaced beginning in 2022. The feedback that we got was Dock D, which is 175 feet. It's the longest of the three remaining. It's at the greatest risk of failure, largely due to the larger boats using this dock. They recommend it be replaced in the coming year. However, they note B and C should also be replaced at the same time. It's of the same age. It has many of the same issues, including deteriorating deck boards, boarding, misalignment of dock units. However, they note it could be deferred one more year if absolutely necessary. So going off of their recommendation and working under the assumption that there may be some potential cost savings in doing all three at the same time rather than mobilizing twice in 24 or 25 and again in 26. We're making the recommendation to proceed with all three in the 2025 budget. The estimated total cost for the project is $500,000. The second project is the East Street reconstruction project. So tentatively, we're looking at East Street from Dibble to King. However, included in the construction tender would also be an additional block from James to Dibble. This is so that we could, depending on what pricing looks like, we could come back to council and give an opportunity to include the additional block if pricing is where in an advantageous position to the town, so that's why you see a budget estimate of 1.4 million to 2.1 million. That's essentially option one of the two blocks, and then option two, including that additional block. Again, at which time council would have another opportunity to make a recommendation.
Thank you.
You're welcome. Oh, and I should mention, if approved, we're seeking to release both tender documents in January, giving us plenty of time to get contractors in place prior to the 2025 construction season.
Great. Any discussions or questions? It's a lot to digest. Councilor McConnell.
Thank you, Deputy Mayor. The East Street reconstruction is, I know you got a big variance there, $1,400,000 to $2,100,000. But the amount of rock involved there is going to have a lot to do with it. It's in an area where we've encountered very deep, hard rock before. I'm not positive reading this, how much, I'd say the maximum and the minimum there would we wind up having to float as far as interest loan type thing.
So if I may, so for the East Street reconstruction, we can pay for the part from Dibble to King, and we expect that to be 1.4 million in that range. So we use the Canadian Community Benefit Fund, the amount that used to be called the federal gas tax, and we've been saving that up for the last 3 years, as well as our reserves for water and sewer. So that can be paid for. If we get advantageous pricing to add that extra block, then I believe we can cover that as well out of our reserves. So there's no need for an actual loan. It's just a matter of, if that 1.4 number is not big enough, then we're going to have to, we wouldn't be able to go all the way to James Street. So really that's the difference between the two. But really, we should be able to afford that entire project, but with the way reserves go up and down. But really, that's the question: is can we afford that part from Dibble to James?
Thank you. Some of the other streets that we've done, St. Lawrence Street, for example, we went from the river to the railroad tracks. Do you know what the situation is with the sewers and the water lines from James Street north to Wood?
Yeah, so they've all been cambered, and so we know they're not great, but they're not as bad as south of Dibble. Really, when we're anywhere along East Street, the road base isn't good. So that's one of the reasons why we would also want to really focus on kind of replacing the whole street eventually. But really taking a look at that Dibble to King as being and we believe it to be in excess of 100 years old. The part that's a little bit between James and Dibble, similar age, but it has been, other portions I haven't updated. And then above James, it seems to be much better.
Okay, thank you very much.
Thank you. Councillor Ham?
Thank you. Through you, Deputy Mayor Burton. I was just going to say, since we've undertaken a professional evaluation on the docks, I think we'd be hard pressed to not move forward with that. That's just my input on that.
Thank you. Councillor Campbell?
Through you, Matt, with the docks, then the RFP goes out in January. Would they do the work before the marina opens or during the season?
That's a good question. Okay, so our delivery date is always when the Victoria Day, and they have not indicated that there's been any issue with that. If they get the order in January, February, then they're able to meet that May timeframe, because that's the vast majority of when their docks are due. If we're with a dock, I think it took them about 6 weeks to turn that around, but that's only because we got into May by the time we made that decision, and that after it broken away. So absolutely all of the work would be intended to be done before Victoria Day.
Great, thanks.
Thank you. Any other?
I just wanted to add to, I agree with Councillor Young that we've gone this far with the docks. I think it'd be hard to not do it. Now, the East Street project, these are very large numbers. So if they come in right from the get-go over budget, what do we do then?
So there's a couple things that we can do. One is we go through a value engineering. So if all of the numbers come out way beyond what we expect, so we would go through a value engineering and say, if there's some aspects of the project that we would not want to move forward with, that sort of thing. And so sometimes that can get us into the ballpark. I think what we've found is that we get a fair amount of response when it comes to our reconstruction project. And that drives the price to be very competitive.
Good.
So I think that is certainly something that certainly helps. And just going back to Councilor McConnell's question. So when I take a look at the sanitary, the ones that run below Dibble Street and down to King Street are very old. The ones that run above Dibble Street and up to Wood Street are PVC. So it gives you an indication that the water main itself, I don't think has been replaced along the whole length. So the sanitary, and that's why we would put it as a provisional, depending on price. If it's a great price, then doing that to James makes perfect sense. If it's not a great price, then it's not something that is going to cause a major issue. But at Dibble to King Street, and really part of what our pricing was is based on Henry Street East, when we had that issue a few years ago, and there was a substantial amount of rock. So building that kind of rock quantity into the estimate is really what we're looking at.
Okay. Yep. Councillor McConnell?
Now, what Matthew just said is a prime example why we should do everything at once when we're doing a street, and why we always have been since I've been here anyway, because you just mentioned that block has PVC piping, which means it's already been dug out. The road's been rebuilt, it's been put down, but they didn't replace all the piping rather than taking out a loan to do it. And now we've got to take the whole thing up again, rebuild the road. We've did this, or previous council did the same thing on Boundary Street, and it was subject to breakage after breakage pretty much every winter for several years. So to not do the whole thing, I think, is very poor judgment, and I would rather see us not do it for another year than do a partial job and cause a problem for future council. We should try and avoid that. Thank you.
Thank you. Councillor Kirkby?
Through you, Deputy Mayor Burton, just a question that I mean, it would be done in stages, wouldn't it, Councillor McConnell? So you wouldn't shut the whole street, you didn't shut all of St. Lawrence Street down at once. You would have did the top half and then the bottom half. Right,
Start to the bottom.
so in theory, what's the difference from, from doing one this year and one next year? If you're doing it in chunks, I mean, it's a different year, but you're still doing it in chunks.
If I may,
Absolutely.
I'm sorry, you misinterpreted what it said. Doing it in chunks is what we did in St. Lawrence Street. We did it up to Park Street, I think it was, Matthew.
Yes.
Actually, I'm not even sure you were here then. It came in less than we thought it was going to because there wasn't much in the way of rock. So we elected to go, but we did everything when we had that section dug up. And what I'm saying here is that when we're digging it up, we should do everything at the same time, not, I didn't mean to for the whole street at the same time, but if we're digging up from Dibble to King, then whatever is under there gets replaced.
Okay.
Not part of it, because then we wind up having to dig it up a few years down the road. But we don't have to replace everything, or do we replace everything? It's just not a good way to do things.
And this will include everything.
Absolutely.
This includes everything. in
So
it.
to give you an indication, there is new storm currently on East Street. So that will be installed, new water line, new sanitary, new sidewalk on one side, and then completely new road base and whatnot. So really it's, and as Councilor McConnell mentioned, there's certain places in town, and we saw it on Dibble Street East, is that somebody may have done one block of storm, but not the whole thing, or they replaced the sanitary, but not the water main. So when you do that, it just costs so much more than just taking those disparate different items. So really, if you're opening it up, open it up once, and then you're good for the next 80 years.
Follow
One
up?
more. Yep.
Councillor Kirkby?
So sidewalk on one side of the street, I believe on that section of street from Dibble to King, there's sidewalk on each side currently.
Correct. So what we're really trying to focus on is, as we're replacing streets going forward, for those non-major streets, going down to one sidewalk. Because at this point, we have twice as many meters of sidewalk than we do of road. When we have it on both sides. And so, on King Street makes perfect sense on both sides, on portions of Edward, it makes sense on both sides, but a small residential street like East Street, it doesn't make sense. And when you're driving down there, by rights, if you have a parked car, you'd be hard pressed to try and fit two other cars side by side. So by eliminating that one side, it allows us more pavement and being able to traverse the Wall Street.
So yeah, that's where I was going with it. So we're gonna eliminate one sidewalk. We're not just gonna leave an older one on one side and new one on the other side.
No, and so absolutely, everything gets taken out, everything gets put back in a much more methodical way of street design.
And isn't the one side newer at the top?
We have replaced some portions because they were in such bad shape. But yeah, so when we did Dibble, we came around the corner a little bit. And so from that point onwards, we would work. We wouldn't go and replace what we just replaced.
Do we have a side? Just in case any people on East Street are watching currently, do we have a side that we're?
I think it makes sense to do it on the west side because Henry Street connects to the west side. So if you're walking down Henry Street, you don't have to go across.
Perfect, thank you.
Thank you. Anybody else? Okay. Nope, we're good. Okay. Do I need to reread the motion, or is everybody good? Everybody's good? Okay, I'll call the question. All in favor? It's carried. Thank you. Okay. Moving right along to 12.3, staff report 94, 2024, the Prescott Family Medical Association support request. The recommendation is that staff be directed to work with Augusta Township and the Township of Edwardsburg Cardinal to develop an agreement that addresses the financial request made by the Prescott Family Medical Association to lower overhead costs. Can I get a mover for that, please, for discussion? Councillor Kirkby? Second? Councillor Campbell, thank you. Matthew?
Thank you very much. So, this is a follow-up from the tri-council meeting. So, really, they came looking for support to lower the overhead costs. My understanding is the request is approximately 22,000 per year in total, which could be split between the three municipalities. It was noted that overhead costs are generally higher, and that's partially due to the relatively small size of the team. They do have additional space for 2 additional physicians, and in which case it would decrease the overall proportional share of overhead costs and negating this request. So certainly some of the things that we would look at is if they were successful in recruiting another physician, that the support would end. And then I think there was some discussion about whether it's a 1-year agreement and then going through the community grants program to request additional funding, or whether it's a 3-year agreement. So I think there's still a little bit of details that need to be worked out, but certainly the feedback I think I got was generally an agreement of wanting to support the medical association or medical associates. And so it would be approximately $7,300 per year per municipality. And as I mentioned earlier, when we passed our original 2024 budget, it increased, it had the increased amount for the St. Lawrence Lodge levy before they knew exactly what their amount was for funding. So we put $102,000 into a reserve to be able to address future increases, which, you know, as I just mentioned, if they increase 35%, then it wouldn't have a bottom line impact in 2025. But we still have that $102,000 that we could use but for perhaps one-time expenses, and this being semi-related to healthcare and long-term care and being the same basket of services that you can apply some of that support to. So it's just an option that if you wish to use that $102,000, that you'd be able to do it without having to increase the property tax burden. Thank you.
Great, thank you. Any discussion? Councillor Campbell and then Councillor Kirkby.
Through you to Matthew, my understanding from the Tri-Council was that it would be for 3 years, 3-year commitment, because not all townships have the same kind of community granting system that we have. So that was my understanding. Okay.
And yeah, I think I just wanted to kind of put that out there because I wasn't there, but my understanding was mentioned. So working with Augusta and Edwardsburg Cardinal, we would either come to a 3-year or something, but ultimately we'll come back to council for the final consideration.
Good. Councillor Kirkby.
Thank you, through you, Deputy Mayor Burton. Just first of all, I want to say that the all council supports this. The 3-year term was floated. There was also a flip side of that coin where we didn't want to put it onto the new council. That would be in place in 3 years, but I looked at that and said, well, when I came on to council, there was already commitments from the previous councils. It wouldn't bother me to put it onto the next council if it came to 3 years. I just wanted to share that this weekend I was away at a hockey tournament, and one of the discussions that came up by one of the parents on the team was they just got a call from the Prescott family health team that they'd been on a waiting list for a doctor, and they actually just got accepted by Dr. Cook down there. Wow. So just unfortunately they were in Augusta, not Prescott, but just to give you that heads up that they are actively calling and getting to some folks that are on a waiting list. So thank you.
Thank you. And interesting enough, you made a comment saying that we don't want to commit our previous council or not previous, our next council, but I have a different way of looking at it because we're not narrowing our vision. It's the vision I feel is what we have for our town. It's just not a 4-year vision. It's a vision long-term moving forward, right? And anyways, I totally agree. We should definitely support this. Any other, Councillor McConnell and then Councillor Bucket? Okay, Councillor Lockett.
Okay, so,
Councillor McConnell.
so I think the 3-year commitment was discussed and fairly agreed on. And if we commit to a 3-year agreement, it doesn't mean we can give them the cash this year and they can apply for the grant next year. We're committing to them. So if they don't qualify for the grant or they see fit not to apply for it, we would be able to cover it. But if the grant money is there, why shouldn't they apply, I guess?
Right. Thank you. Councillor McConnell?
Thank you, Deputy Mayor Burton. Everybody got a kick of the can, so to speak, and I got the distinct impression, I think the second last one to speak, but that everybody, some reluctantly, some didn't feel that we should have to. I think I heard somebody say it really wasn't our mandate. But it is our mandate if you look in our book, because I wrote something down, I looked it up before I came. But our mandate, the role of council, section 224 of the Municipal Act, it is the role of council to represent the public and to consider the well-being and interests of the municipality. And I think that pretty much hits it right on the head. We get sidetracked because sometimes we get asked for things that may be our mandate, but we've never really considered it our mandate because we've never had to do it before. And there are many things over the course of the time that I've been here that has been the case, that we've been asked to do things that we didn't do before. The community grant structure, for example, when I came here was, I think, around $30,000. Now it's 63, 8, 5, 50.
Potentially.
Yeah.
20.
So, quite obviously, there's a lot being given out there that wasn't applied for, that wasn't given out before. Is it part of our mandate? Is it not? It all depends on how you look at it over time. And our viewpoints on what we're responsible for change over time as society changes. So I'm definitely in favor of this. And as far as the how it's funded, I think what Matthew suggested from the, I'm not going to say the excess for St. Lawrence Lodge, but the non-contribution or savings of St. Lawrence Lodge, that's where it should come from, and not the community grant structure. Quite frankly, if either Edwardsbury Cardinal or Augusta want to take it out of some community grant structure that they have, I don't really care. I don't care where they get it from. And quite frankly, I don't think it's any of our business where they get it from. It's up to their individual councils. I think they've all pretty well spoken that they want it to come, and it's up to them where they get it from. So if one of them wants to get a community grant structure, fine. If we want to take it from our St. Lawrence Lodge, then that's fine. Ruth is correct. They did ask for a 3-year commitment. And the reason they asked for a 3-year commitment is they've got to sign a 3-year lease, which they haven't signed yet. They've been putting off, and there's some bad feelings there, as I understand it. It is imminent. It has to be signed, and they want a commitment from us before they sign it. So Ruth made it, to me, was one of the most memorable comments of that whole evening. Well, it had to happen sooner or later. And she said, it's a bandage. And she's right, it is a bandage. But if you well, maybe some of you won't recall because you weren't here, but they first came to us with almost that exact same presentation in 2022 in Spencerville, and 4 of you weren't here. But very similar thing. We didn't do anything about it. No counselor asked to have it brought forward. No member of staff brought it forward. It was an election year. Maybe that's the reason. I don't know. I'm as much to blame as anybody else. But we all know that they appeared here before us again in March of this year again appealed to us, and again, nobody did anything about it. So while I was extremely glad to see this come forward through Augusta Township, given the fact that these people have their offices in Prescott, quite frankly, I'm embarrassed as a member of Prescott Council that it had to come to us through Augusta, not the other way around. I think we owe them the 3-year, it is a bandage, and they did indicate that if they got one doctor, just one, have room for 2, but if they got one, then that bandage could be ripped off because they wouldn't need it anymore. But this is a bandage that's covering a wound that goes back to 2022. It's been there for a while. They've needed it for a while. And I would like to see us, honestly, I don't like the wording of this thing here. The recommendation that staff be directed to work with Augusta Township and the Township of Edwardsburg Cardinal to develop an agreement that addresses the financial request made by the Prescott Family Medical Association to lower overhead costs. To me, that's pretty wishy-washy. I would rather see us say we will agree to somewhere, I leave it up to Matthew, come up with the 73.33 per year for 3 years. And if we want to get together with the other 2 townships to develop some kind of another possibility with them. And Dr. Cook very generously offered to assist us in finding another doctor and advice in that respect. I would expect staff to get together with him and to get his viewpoint, his suggestions, what we could do, because really we haven't done anything in the last 3 years. So my suggestion would be to forget the recommendation and put it a little more bluntly that we are definitely committing the 733. Thank you.
Thank you.
Well,
Yep, Councillor Kirkby?
through you, Deputy Mayor Burton. I thought, so I know that they appeared in Tri-Council before and then they appeared here in front of us. My message to Dinny has always been that it needs to come to Tri-Council. I mean, so if we signed that 7,300 today, we'll just use that number because it's easier. But Augusta and Edwardsburg Cardinal does not, then that's a whole new discussion, right? Because it sounds like they need at minimum is the 22,000. So, I mean, I'm all in favor of giving this money, but I think we need to understand what's coming from the other townships first. And I think that's kind of where Matthew's going with this, taking it back to the CAOs of other townships, is that correct?
Yes, and so the intention is to develop an agreement that if they were to receive or were successful in getting a 4th doctor, that the payments would end. And things like that. So really that was the intention behind just creating the agreement. But if council wishes to modify the recommendation, then certainly that's more than acceptable and well within your rights. I did want to just clarify that it didn't come up through Augusta.
Right.
We felt that it was the best format and best venue to have that request if they were requesting all 3 municipalities. So all three CAOs as well as the 3 mayors kind of worked on it together. So it was just that Augusta was hosting that meeting. But if we'd been hosting the meeting, then we would have issued the agenda. But certainly it's being worked on by all 3 municipalities.
No, that's been my statement to Denny since last May, was it's a tri-council. Tri-council issue versus one municipality. And so my question is, I think we need to confirm with the other townships what they're giving, because if one opted out, the ask may be more to Prescott, if you kind of follow that, right? If that happened, would they come back to us asking for more? Right, if only 2 groups participated for 2 years or 1 year.
My takeaway was all three are committing what they asked for 3 years. And I think that probably Augusta has already done that. And I can't speak for Edwardsburg, but I think the ask was the 73-33 for all three for 3 years. And I think that's what that was my takeaway from that night.
That was my takeaway too. I did talk to the mayor of Edwardsburg Cardinal and he was quite committed. I'm not putting words in anybody's mouth, but during a conversation afterwards, he's like, this is a no-brainer because,
Yeah.
you know, not necessarily it affects our municipality, it affects our neighboring municipalities, right? And we need to all work together and create this partnership to help the Prescott Family Medical team.
So once we know exactly what's everybody else is committing to, then we should be able to have someone come back to council and say, yeah.
So the recommendation is just directing staff to work with Augusta Township, Edwardsburg Cardinal, and develop an agreement. It's not necessarily putting financial, it says addressing financial request, but it's not saying 7,300, it's not saying 22,000. It's just creating that, that partnership. And I'm assuming, if I could, when the final numbers are presented, would it be brought back to council?
For you, Deputy Mayor, yeah, every municipality would bring their own agreement back to their own individual council that wouldn't be agreed upon at the tri-council level, an individual municipality.
Yeah.
Right. Councilor McConnell?
Thank you. My concern here is the glacial speed at which we seem to move in government.
Yeah.
We have one meeting left before Christmas. We have a kind of an odd schedule in January because of because of what we all know is going on in Toronto. They're involved with the lease, and they've been putting off signing this lease till they get some kind of a commitment. I would like to see us make the commitment tonight because this could easily drag into sometime in February before it comes back to us. And I don't think, given the past history on this file, that is acceptable at all, not to the doctors. I'm not happy with the way it's worded simply because of the time. Now, if Matthew was to jump up and wave his arm and say, I will have that back for you for next council meeting, I don't see him jumping, but that would be acceptable for me. I believe it would be acceptable for the doctors, but otherwise, we're in a God only knows when. I would guess February, and I don't find that acceptable at all.
Go ahead, Matthew.
He's waiting.
But he's not jumping up.
So I am waving, not jumping. So what you could do is amend the recommendation to say that the council approved a 3-year commitment in the amount of up to $7,333 for the Prescott Family Medical Associates, and to direct staff and the rest of the wording in there to develop an agreement. So
I would find that perfectly
so
acceptable.
that way we're committed to this up to 7333. We can say that we're committed and now we're just working on an agreement for details. And that way BC and Augusta, it's up to them now.
Good. I find that perfectly good.
I'm good with that.
Okay, so Councillor Kirkby, you were the mover, and Councillor Campbell, you were the seconder. Are you okay that we amend the motion?
Yes.
How would we like to do that, Ms. Falcon?
So through you, Deputy Mayor, so the amendment would read that would actually include the monetary amount.
Yes.
That council directs staff to develop to move forward with a payment in the amount of $77,330 or what? I'm trying to get the wording. So first we have to vote on the amendment and then that would be the whole motion. So we'll be adding that to the main motion.
So I would say add it to the beginning and that council
Then direct it.
approve a commitment, a 3-year commitment of up to $7,333 per year to the Prescott Family Medical Associates to lower overhead costs, and that staff be directed, blah, blah, blah.
Okay, so through you, Deputy Mayor, Councillor McConnell, did you want to move that amendment? To amend the motion to add in that council approve the 3-year commitment up to $7,333 per year to the Prescott Family Medical Associates to lower overhead costs?
Well, I'd be glad to do it, but Justin and Mary have already moved the previous one. I think that would be.
This is just the amendment.
Oh,
Yep.
certainly, yes.
Okay.
Yeah.
Can I have a second to that amendment?
Councillor Kirkby.
Okay.
Can I have, is there any more discussion?
No.
So that's just the amendment.
Okay.
Jesus.
So if council approves that amendment, I'll then read the entire motion. Is your question about the amendment?
No, it's just a statement.
Can you,
Just to direct my statement to Councillor Lockett, I don't believe they would qualify for our community grant, the way the criteria is written.
Mm. Okay.
So that's not an avenue.
okay, thank you. Go ahead.
Okay.
Thank you.
Oh, okay, so right now we have the amendment that the motion be amended to add that portion. I have Councillor McConnell moving it, Councillor Kirkby seconded it.
Mhm.
And if you'd like to call the question on the amendment.
All in favor of the amendment?
Perfect.
Carried. Thank you.
So then the amended motion will now read that council approve the 3-year commitment up to $7,333 per year to the Prescott Family Medical Health Associates lower overhead costs, and that staff be directed to work with Augusta Township Edwards Cardinal, develop an agreement that addresses the financial request made by the Prescott Family Medical Associates to lower overhead costs.
Okay,
Good.
that's great. Now, do I,
All the questions.
And so now the question on that whole amendment, which the mover was Councillor Kirkby and Councillor Campbell.
are you okay with the amended motion? Yes. Okay, any further discussion? I'll call the question. All in favor? Carried. Thank you. Great. Thank you very much. We have 12.4, staff report 95, 2024, position recruitment, human resources, and this is just for information only, and Matthew Armstrong is going to be speaking of that. Thank you.
So, again, the presentation from Health Innovations, on number 18. The tech report, went through what they discussed that evening. And really, I'm going to kind of skip over all of that part and just talk about the initiative of healthcare recruitment, whether that's physicians or other positions in healthcare, aligns well with our 24 to 2027 strategic plan prior to, which is to strengthen community health, safety, and well-being. And one of the strategies was to identify was to advocate for the recruitment of additional medical, mental addictions and health practitioners. So really what's being put forward, along with the request from Prescott Family Health Team to recruit physicians, because they mentioned that they had capacity for 2 additional physicians, both capacity and space. And that is one of the major hurdles when it comes to recruiting physicians. Where are they going to go? Is our practice already set up? Is there space already allocated? And so being able to offer that through Prescott Family Health Team is certainly very advantageous. 2 areas that we might want to consider if we move forward with this is that it's important for Prescott that the new family physicians, when they're being recruited, are focused to serving the outlying communities. So anywhere that they're in the family health team or community health center, then being able to, that already exists, then they tend to have space. They already have the staff in place. They already have a billing process. They can really move that person in and start pretty much day one. And then the other is that if the family physician doesn't come to Prescott, that all residents in Leeds and Grenville have an opportunity to be rostered with that family physician regardless of their location. So really, I think when I think about what is important to Prescott, those would certainly be two areas. And the city of Brockville already passed the motion that council directs the mayor and the city manager to signal the city's interest in participating in discussions related to regional physician recruitment with the United Counties of Leeds and Grenville, the town of Gananoque, and the town of Prescott. And that staff be directed to provide assistance in drafting a memorandum of understanding with respect to funding, key deliverables, and other key elements of physician care recruitment strategy or consideration. So before bringing that to making that recommendation, we really wanted council on an opportunity to discuss what was learned through that presentation and really see where you would like to go. Even if you do pass that as a recommendation, it doesn't commit you to participating. Really, it commits us to starting to work on an agreement or a memorandum of understanding that really outlines what our financial commitment would be, what are some of the guidelines, what are the deliverables, what are the milestones, things like that. So just want to present this to council, see where the discussion takes, and then with the direction.
Thank you. So before we move on, it's just for information purposes, so we're not discussing it, we're just absorbing it, and we're going to discuss it at a later date.
So through you, Deputy Mayor, council at any point can make a motion if they wanted to support the same motion as the city of Brockville. But I believe we can always bring back more information if that's what council wishes.
Okay, I'll open it up for discussion. Okay. Councilor Campbell?
I've been meeting with Denny Matthew as well as Dr. Cook, sorry. And this to me is a lot of money, but it's a good program. It's going to do well, but I kind of agree with Councilor McConnell that it might, to me, it's a 3-year before even they get their feet on the ground. It's a plan, make a plan. You're doing research on, how many patients there are out there, how many doctors they could get. It's not guaranteed that Prescott would get the doctor, which would solve our Band-Aid problem. So I'm not opposing this, but I'm just hoping that in future we can talk about some kind of committee that we could create here in Prescott. I know that Dr. Cook has mentioned that he would freely give his time to start up a committee. There's great ideas we're surrounded by medical schools. We've got Ottawa U, we've got Queens, we've got McGill. You need to go to their job fairs. We need to get our feet on the ground more than just setting up the framework to get it going. So again, I agree with this, but I'm hoping that we could put a bit of a budget together to get a committee together to look at residency programs, to perhaps fund a resident doctor in, one of his years of schooling, to say, he will do this for you, you come and you work for us for at least 5 years, these kind of things. So to me, it's more boots on the ground rather than airy-fairy we want to do this and we hope this, and that's my wish. But again, I think this is a great move for the whole area.
Thank you. Any other discussion? Councilor Young?
Thank you, Deputy Mayor. Matthew, who would represent the town of Prescott in the memorandum of understanding?
So I think the CAO as well as the mayor would likely work on the memorandum of understanding, trying to hammer out exactly what that could possibly look like, what the terms are, what the milestones are, things like that. This is kind of a little bit of a different take on physician recruitment. So what you were mentioning, we don't have the financial firepower to be able to compete with the Kingstons, Bellevilles, the Torontos of the world, because they're offering 6-figure sums for them to just come in for 3 years. What I think what this is trying to do is take a different approach to it, to say, how do we highlight where the opportunities are, where you're practice ready, whether that's a family health team or community health center, and be able to entice either out of area physicians, out of country physicians, those types of things. And I think that's where this particular initiative is slightly different than what we see, because at the end of the day, a city like Belleville, they're shoveling money at the item, and there's no way we're going to be able to compete on it just based on financial terms.
Follow up?
Oh, thank you. I was just gonna say that I think it's important that council contribute some suggestions that we would like to see in the memorandum of understanding. Because I know one of the things that, one of my concerns, and I agree it's a very ambitious project, but it's a wonderful idea to get it going. But similar to, say, the St. Lawrence corridor, I would just really want to know that we were going to, there was a reporting back to us, like on a regular basis, that we know what's going on, what they've achieved, what they're planning on doing in the next quarter, that kind of thing. Just a regular reporting back to us since we're making an investment. That's all. Thanks.
Thank you. Councillor Lockett?
Yeah, we have had a physician recruitment committee since I came on council. And as Family Health Team said, they have been recruiting in however they go about it. They have not had one bite with anything. So for us as a council or municipality to try and shine, and I just don't think we have the capability and we don't have the funds. And I think this project, it is ambitious, but the people that are involved are dedicated. And I think they've got the resources and they've got the connections that we just don't have. And we would just be entering into letting them know we're interested. That's my understanding. And we've just committed $7,300 for a 3-year plan to help keep their overhead or pay the rent or whatever it is. So that I don't know. I just don't see the two of them as the same thing. So I'd be in favor of the recruitment.
They're professionals, right? They're professionals.
They have connections we don't have.
Right? And they're committing the time, right? Councillor Kirkby?
Yeah, through you, Deputy Mayor. Matthew, the memorandums, they would come back to council, right? So we would get a discussion on them and an opinion there, I believe. And then just, you just touched on it. So, I mean, this recruitment plan would bring doctors potentially to the 2 available spots at Prescott Family Health Team. Is that not correct? They're not only working with one health team.
Right, so
It's open.
basically working with all of the CHCs, the community health centers, as well as family health teams. And I think, you know, that if Prescott wants that to be an agreement, then yes, being able to focus those family physicians to places where there's already that infrastructure, then I think it's a really great starting place and it's very advantageous for new physicians. People will say, I don't have to set up my office. I don't have to hire my admin staff. I don't have to hire my other medical professions. It's already there and ready for me to go.
So just on that note, because I believe during their presentation, the one thing that was mentioned was having physician-ready locations.
Yes.
Was key. So I guess my connection goes to, would there be some way to advocate or at least make aware that we have a location in Prescott that's physician ready?
That's one of your
That was one of the.
I think it's step number 2 is taking that inventory and saying exactly where is the infrastructure, where are the opportunities, where are the vacancies, where's the need, and then being able to marry those up. And so said in a brief conversation as a follow-up that there's a portal on the Ontario website that you can sign up if you don't have a family physician. And then that, they're able to take that information and say, okay, we have 3,000 people in this area that need a family physician. And then it helps to make that case to be able to say, this is what your potential roster is going to look like. Because we know there's a big need in this area, you're not going to struggle to get to your roster numbers. Versus, adding where there's already a plethora of family physicians and they're very low, then certainly we would want to add another family physician to that area if there's a higher need. So really, those are some of the things that are starting to be talked about to be say, where do you go and where do you want them to go, and then where's the
Last comment, based on that, it may be something that maybe we would share on our social media, so residents of Prescott that are unrostered know where to register on the ministry website, which may help add to the numbers of the area.
absolutely.
Good
I
point.
think that is that as a municipality, that's where we can really start driving that need and that information out to residents to say, if you don't have a family physician, this is where you need to go. So, and we would want to see that increase from X number today to 2 or 3 times that, because it's hard to say that we need physicians if the data is there.
Thank you. Meg,
What do you mean?
it's something we can post.
Right?
We don't put that on my council page.
There you go. There you go. Excuse me. Go ahead, Councillor Campbell.
Through you again to Matthew. So with that, would it be important for Prescott Family Health Team to open up their waiting list? Because they have closed the camps.
So really, we would want to make sure that from the provincial portal, because that is the one that's the easiest way to compare places and residency as well as where the need is. And so I think we would want to drive it there so that way we can say, here's the need for Prescott, here's the need for Edinburgh Cardinal, here's the need for Augusta. And then being able to say, this is where we could pose that physician or that medical professional to be able to address this need.
And then my other query is, will they come back, like they've kind of given a base amount, but will they be able to tell us really what extra money we need to do the rest of their deliverables?
Right, and I think that will be all part of the agreement. Certainly, I think there's quite a good discussion that has to over the next few months, be able to really drive down what is the base amount and what are the extras. And what does that look like and who's responsible for paying?
Thank you.
Thank you. The other, Councilor McConnell?
Thank you, Deputy Mayor. I think it's important to remember here, we've heard about what these people are gonna bring to the table and the amount of time that they're gonna spend on this. But when you look at what we have here, I'm just looking at the descriptions. This says create, evaluate, develop, engage. None of those say deliver. And there's the key. We are not going to be paying these people $180,000 a year for 3 years to guarantee to bring a doctor, a nurse, personal support care workers to one of our homes. We are going to be paying them to look at what we have, what other people have done, and point us in the right direction. So there are going to be other costs coming down the line, and they could be significant. But that being said, I think we'd be very foolish if there is an impetus to actually do something here, because Matthew, how much have we spent on doctor recruitment in this term? Off the top of your head.
For recruitment?
Yeah,
Nothing.
nothing. Okay, so there we go. If you don't spend anything, if you happen to get something in the door, it is pure luck. I had a Dr. Cook happens to be my doctor, and after they appeared here last March, I happened to occasion to visit the office in April. And he didn't recognize me, but to the appointment, I said, I had the question. He said, I thought you looked familiar. So what we talked about is why a doctor would come to Prescott or wouldn't come to Prescott. And some of what we've said here tonight and some of what was brought forward at that Tri-County meeting kind of all goes together. But if you take a doctor that's just graduated, for example, he's got a tremendous debt, unless he's extremely wealthy, he has a tremendous debt. So one of the things he's going to be looking at is, okay, where can I go to pay off this debt? Because it's a many year process. The second thing that they are going to look at is lifestyle as well as the debt. Where can I go that has a lifestyle that I actually want to spend some time? And it was stated at that meeting, and we can state it around here, and I agree with it because I'm from a small town. And I think we all are pretty much. And I have no interest in moving to Toronto or Kingston or Ottawa. I wouldn't think about it. I like this lifestyle, but not everybody does. And the other thing he mentioned is opportunity for employment for a spouse. And the odds are that a doctor is going to have a pretty well-educated spouse as well. And if there's no opportunity for them to be employed in the area, then that's pretty well just counts that area out. And Prescott just doesn't have that. So consequently, we don't have any doctors living in Prescott. Our doctors used to all live here. Now they don't. Matthew mentioned Belleville about they have oodles of money to spend or have spent it. I'm sure you got that from somewhere. I didn't read that, but there was an article in the Bronco paper a couple of weeks ago in regards to Gananoque, which is part of our area. It's part of United Counties. They are invited to become part of this thing that we're getting involved in, or at least I hope we're going to get involved in. And I had the article with me at the Tri-Council meeting. The opportunity didn't come up but I was talking to Deputy Mayor Steve Bilbach from Edwardsburg Cardinal after. He wasn't aware of it at all, and I gave him the article. So I'm going to quote a couple of figures off the top of my head, and I may not be exact, but they're in the ballpark. Gananoque is spending $80,000 a year on physician recruitment. Gananoque has guaranteed a new physician $20,000 a year for 5 years. And I'm a little vague on this one, but they are contributing something. I'm not sure whether it's all or a portion of the rent for the doctor's offices and the utilities for the doctor's offices. Now, if we have, and with what I just said about opportunity for spouses, they're within easy driving distance of Kingston, where there are hospitals, university, lots of employment opportunities. So if we are both participating in the same program, and Gananoque is offering all of these things right now, what the hell hope do we have of getting a doctor to come here? Why wouldn't they go to Gananoque? The quality of life is the same. They're both small areas. They're closer to Kingston. So I'm in favor of going ahead with this, but I think a very serious discussion needs to be had. And I think we need to get Dr. Cook involved in it because he's already volunteered as to what we actually need to do. And I know we can't go out and spend $100,000 and $80,000, but there may be some other things that Dr. Cook suggests that we can do that are more reasonable. So I think a discussion needs to be had here, and it needs to be had soon. I would say this winter. So thank you for the opportunity to come.
Thank you. Councillor Kirkby?
Through you, Mayor Burton. Deputy Mayor Burton. Just this here is just a recommendation. I mean, there is a need. One thing I'll say is a lot of professionals now work from home, so needing to travel is not that big of a thing for some spouses. My wife works from home in the healthcare business. When she needs to travel, she does, but 90% of her working days are in an office in our house. Same with myself. So it's not as big of an issue. I think, the thing that, and it was announced by the current provincial government just last week, is that there is a recruitment of 200 professionals for the area. I know on social media, a lot of people took that the wrong way. They missed the professional part. When you read this, the recruitment comes from other countries, including South Africa and stuff like that. So, for me, the $7,000 really isn't much for a program that could potentially put doctors close to us that we could benefit from. And I believe it was Mayor Deschamps that pointed that out to me at the Tri-Council when I was maybe a little closed-minded on needing doctors to be here. We already have a place that's too physician ready in a sense. I would like to not wait on this and put the motion forward as Brockville has to get us into this and get us into it now so we can get the rest of the county municipalities on board also that are part of it. So I would put the motion forward that is in this on the Prescott part and look for support tonight so we could get this going sooner than later, because we've all talked about it, how long things take. But maybe we should just get it done tonight.
So Councillor Kirkby has a motion on the table and Councillor Lockett has seconded.
Sorry.
It's okay for you, Deputy Mayor Burton. I saw where this was going, so I pulled up Brockville. So the draft motion I have reads that council direct the mayor and CAO to signal the town's interest in participating in discussions related to regional physician recruitment with the United Counties of Leeds and Grenville, the town of Gananoque, and the city of Brockville, and that staff be directed to provide assistance in drafting a memorandum of understanding with respect to funding, key deliverables, and other key elements of a physician care recruitment strategy for consideration.
Great. Yeah, that's great. Any last comments? Councillor, sorry.
Go ahead.
Okay.
Just to be clear, this all comes back again for discussion, right? So there's nothing that we can't add later.
That's correct. That's correct. Okay, one last comment, Councillor McConnell?
I'll throw it out. We discussed the 7,300, whatever it was, as part of the previous motion on the doctors. Should the $7,020 per year be part of this motion?
If I may.
Yeah, absolutely.
So I would keep it out because that's only based on the base amount. It doesn't include any of the others, which we will have a better understanding of as we work through that memorandum of understanding. So that number may change and quite possibly will change. And so I would just caution that would only cover the base amount as opposed to any other activities.
Okay. Any further discussion? Okay, one last statement. Thank you.
Belleville had offered $25,000 a year to residency doctors for 6 years so that they would come and work for 5 years committed service. So they were paying $25,000 a year and they got 6 to 7 doctors.
Wow.
Okay. Thank you.
So it was directed.
Okay.
Okay.
Thank you. So the motion is on the table. I will call the question. All in favor? Thank you. It's carried. Okay, moving right along. We don't have any resolutions or 14 bylaws. We do have new business, 15.1, and it's Council McConnell that will speak to this.
Thank you. You know what this is? I gave notice of it last week and read it. It's in regards to the policing, the OPP policing. I have no complaints about the policing that we get. But I think the price is getting up there again at the point where it was when it was readjusted. That was about 1.1 million from 2 million. We're up to almost 1.5 million now, and it's going to get to the point where it's choking us from doing things, from buying things that are much needed in this town. So I understand that the provincial government, and Matthew mentioned this, is looking at this issue, but I think that the more people that kick in on this, keep the pressure on it, especially in election year coming up, they may be inclined to do some movement on this. So I'll read the motion. Whereas in 2015, the provincial government, after much lobbying by municipalities, moved to standardize billing for non-contracted, that's 5.1 OPP locations. And whereas this standardized billing provided much needed relief to municipalities like the town of Prescott, who at the time were at the top of the existing fee structure, but at the same time resulted in increased budget pressure on those municipalities towards the bottom of the same structure. And whereas the inexorable upward creep of OPP costs during the ensuing 10 years is once again becoming an undue burden on small municipalities throughout the province, and whereas this increasing burden is limiting the funds available through taxation to address the maintenance and replacement of aging infrastructure and to manage operations in general, therefore be it resolved that the town of Prescott calls on the provincial government to once again re-examine the issue of OPP billing and act forthwith to reduce the impact on municipal budgets, and that a copy of this resolution be sent to the Premier of Ontario, the Ministry of Solicitor General, Minister of Finance, Association of Municipalities of Ontario, and all municipalities in Leeds and Grenville. Thank you.
Thank you. Do you need to make that motion?
Thank you.
Okay, so we have a motion on the table. Thank you. Anybody want to second that? Councillor? Thank you. Any further discussion or questions for Councillor McConnell? I'll call the question. All in favor? It's carried. Thank you. Okay. Number 16, notice of motions, no other notices of motions, mayor proclamations, pardon me. Period for media questions.
No questions this evening, Deputy Mayor. Thank you.
Thank you.
You're welcome.
We're moving into 19, closed session. Recommendation is the council move into closed session at, thank you. Closed session at 7:43 p.m. to discuss matters pertaining to 19.1 approval of closed session minutes from November 18th, 2024, and 19.2 union negotiations. And that the COO, treasurer, director of operations, director, administration clerk, deputy clerk, and deputy treasurer and deputy clerk remain in the room. Can I get a mover for that, please? Councillor Campbell and seconded by Councillor Kirkby. All in favor? Thank you. Take a couple.